30 minutes. We'll go 3, 2, 1, and we're live. TikTok live number 49. Just starting out now. Here we go. 8:26, Monday, the 10th of February. Getting after it. Again, the 49th TikTok live we got here now. First person to answer in the chat already put it in the questions, so we're going to answer that in a second. And top 5 listeners, the entire TikTok live number 49. I'll be giving you guys a shout out in the caption of podcast and the YouTube for the full version. All right, friends, let's get after it. Here we go. What's up, Christine? Pranay Manier said, my girlfriend is an MD. I'm a DO. Will people think I'm dumber because I'm DO once we are both docs? I don't know. I always wonder what the difference is. It's like people ask me, what's the difference between a DDS and DMD? The truth is nothing. For MD and DO, I know that DO schools were generally started afterwards. I have a lot of friends that are DOs. They're awesome, and they're not any different from the MDs as far as like knowledge base and in residency programs. I know DOs that are good friends of mine in the ED, on anesthesia, so you know what I mean? Like, I'm not the best person to answer that question though. I'm just a oral surgery resident, a dentist, right? Christine, yeah. So just to give you guys some updates with Christine, she commented just on the last post I put up on TikTok, and she was saying that, dude, you're like you like always going diesel or whatever. Christine, what was it exactly? And I was like, yeah, it's diesel, it's coffee, it's liver for protein. What else did I say on there? Yeah, I drink coffee. What else was it? Oh, I'm missing one. Zinc for the immune system. That's a big thing of mine. Definitely a lot of zinc. I'm all about the zinc for the immune system. All right, friends. All right, let's continue. Blade Zero Muffin said, you have the same name as an NHL player. Dude, Blade Zero Muffin. That's true. Brendan Gallagher's 11. Last time I checked, he was on the Toronto Maple Leafs. I have no idea if he's still on that team. You know what's really funny, though? That ice hockey player has the same number that I was in college. I played basketball in college. I was number 11. You could look it up. You could look up NYU Poly, Brendan Gallagher, number 11, Skyline Conference, second team Skyline Conference. What was that? 2014, I think. 14. I think it was 2014. Second team all conference. I don't know. So cool memories. Hello, how Rua J. What dental? What dental? I'm not sure what question you're saying. I went to Stony Brook Dental School, but I'm in residency now. Hello, how Rua J. said, what dental specialty do you think if you were open a practice would make the most? Wow, we got to work on the grammar here. What specialty would you open up if you were to make the most? Is that what you're asking? I mean, probably oral surgery. Probably oral surgery would make the most. I know that they got some statistics out there that are way out of line, way off, but general dentistry, because you can quickly get out of residency and open up many practices and kind of scale that way. But I would probably say oral surgery because I could scale that as well. You know what I mean? I don't know. Ninja asked, what do you think about podiatrist? Personally, I hate the feet. That's why I went dentistry. Like, a lot of people say, oh, I can't stand the mouth, I can't stand teeth. Yeah, you know what? And you're right. Some people got the worst breath in the world. They'll take your eyebrow. You see this? This is from some patient's breath. And I'm just kidding. It's just my natural eyebrow color. But yeah, I cannot stand feet. I remember I was shadowing a vascular surgeon, and he was going around all morning, rounding, looking at patients' feet and legs. Oh my God, the gangrene, the black toes. Oh my God, that gangrene I couldn't stand that. So anyway, yeah. What do I think of podiatrist? I mean, power to you. If you can do it at all, I can't do podiatry. I can't stand feet. Let's keep moving on. Mitch Greer said, what's up, Mitch? Would you recommend doing multiple externships at the same program if you enjoyed it your first time? Actually, that's a great question. I would absolutely recommend going back to extern, or at least, hey, can I come back for 1 second look at your program? I really appreciated my time there. And then you go back and then you talk with the program director and maybe let them know that you're considering the program highly. Yeah, I think that's a great idea. I think that's very, very reasonable to do. And it shows that you're really interested and dedicated to that program. I think it's a really good idea. So you do your 1 week externship maybe over the summer after D3 year, before D4 year. And then in the beginning of D4 year, right around the time of interviews, perhaps go back to that program if they can get you over there and do that. All right, that's an excellent question. Christine said, and I take apple cider vinegar gummies. Yeah, what's with this apple cider vinegar? I don't know. I mean, maybe if it wakes you up. People do ice. People do the cold shower. I can't do cold showers. Even if it does wake you up in the morning, I'm not getting up. I'm not getting my ass out of bed in the morning to go take a cold shower. That's just, oh man, you got to be off your rocker to do that. Now, I could imagine before your workout doing a quick minute or two cold plunge maybe, but Yeah, cold showers? No, I can't. No. What else? What did I say? Liver for protein, zinc for immune system. I take a men's daily vitamin. I don't know if it does anything, but what I can say, vitamin D, zinc, great for the immune system. I think those are excellent. I would go with, yeah, I'm a big fan of liver. I have this liver dip. It's excellent. Liver for protein and iron, on the money. On the money. You cannot beat liver for those two things, I would say. Or the tuna packets. Now, that's not going to get you the iron. That's going to get you nice little holdover, in between meals, maybe get you your protein. Those are my go-to snacks right there. Supplements for the immune system. Kyra Yoshi Cage, is remediation normal? I recently failed a part of fixed pros and have to remediate a practical. Yeah, dude, there were a lot of remediations my year with students in my class. Thankfully, I got lucky. I never had to remediate. Fixed pros was my thing. Removable pros? Well, wait a minute. That totally different. I was not a denture guy. I really enjoyed doing crown preps. I really enjoyed, preps and everything, bridges. But yeah. No, I wouldn't worry about it too much. Remediation is generally, you got to remediate pros. If you go to a real good clinical program, pros is going to be tough there. It's going to be tough. They're going to challenge you. And they should, because they want you to work on your hand skills. They want you to get into the sim lab and practice. Okay? Kira Yoshi Cage said, how do you deal with anxiety as a dentist and a dental student? So in dental school, the biggest thing is like really get on your own routine. Get in a nice flow throughout the week. That's going to be number one. And don't really try to, I just did it today. I'm such a hypocrite. I skipped out on my workouts because by the time I got to my things, it was after 8, and I don't start workouts after 8. And that's part of my point. Stick to your routine, set goals, but you got to be in bed by this time at night. Say you need to be in bed by 11 o'clock at night to get up at 5:30 in the morning. That's my schedule. I'm never in bed by 11, by the way. But you need to set your thing. So I need to start turning down the dial at 10 o'clock. Do my night routine. Take my hot shower. Set up the lunch for tomorrow morning. Wash the dishes. Set up the water bottle. Set up the scrubs, the gym clothes, and get in bed. And then you'll be in bed by 11. So keep to the routine on a daily and weekly basis. Your study schedule, your workout schedule. By this time, you need to be at the gym and go. Or another little trick, I used to study at the gym. I used to work at the gym on Sundays, so I was a part of the staff, and I could go in the staff lounge during the week and study, and then whenever I finished studying, immediately go into the workout. Come back in, finish up the study. So just some examples. The way you combat anxiety through dental school, number one is going to be sticking to your plan. The way I organize my plan, my to-do list is To-Do. It's a Microsoft To-Do. It's an app. It's free. Get it? You can organize your schedule and have things repeat on a weekly basis, monthly basis, daily basis. Don't waste time writing things down. Get this app and use it, okay? And then organize and prioritize everything you need to do in the day. And then it's going to repeat. It's going to come back the next day, all right? When you have everything repeating every day, it's the best app in the world. I'm telling you, organize everything and knock things off one by one. As you knock one thing off and then another, and include your exercise in there, include your dinner, include like your nighttime routine. As you knock things off your list of the day, that anxiety starts to ease. I promise you, okay? That's my number one thing. All right, friends. Hunter Kiesling, I'm on the wait list. Gotcha. What are your thoughts on the letter of continued interest to the school? You could definitely send one. I mean, it's not going to hurt. I would suggest calling that program. Just make sure they received all the materials to your application, okay? If you're on the wait list, you already know that they did. So I don't know how I would go about calling. I would definitely call them if you're on the wait list. And think of something nice. Maybe run it by ChatGPT, see what they would ask. Okay, ChatGPT is an excellent resource. Tyrese Loves Cats said, will new or more OMFS programs open in the near future? That's really hard to say. Maybe not more programs necessarily. Potentially in the future, maybe in the next decade or two, I could see that with the consolidation of hospital systems. Not many people taking call at that satellite, so they have to transfer them 2 hours to the other hospital. So I could see them opening up an oral surgery program at that hospital. And if not, probably increasing their spots at that residency program, right? So if they only have 2 spots this year, maybe in a couple years they'll have 3, because then they're going to cover that satellite office. I can see that potentially happening. Tyrese Loves Cat said, what resources did you use to study for the CBSE, and what was your timeline? My timeline for the first time I studied for it was 3 to 4 months, and then the second time I studied for that exam was 1 to 2 months. And the biggest things, UWorld Question Bank and AMBOSS, all right? You got to be hitting those hard. The first time you go through UWorld, though, I would go section by section, learning it using Sketchy Farm, Sketchy Micro, Pathoma, boot camp as the learning materials, and then reviewing it with the questions at the end. Once you go through UWorld topic by topic all the way to the end, that's your first pass. Do your second pass with questions randomized. And now you're really going to start to review, but you're going to work on test taking strategy, okay? That's my thing. And then you work in AMBOSS after you get about 30% through the UWorld questions on the second pass, okay? Switch to AMBOSS, and then however much time you have to get through those AMBOSS and UWorld on your second pass, do that. Okay, that's the tip. And if you need review on this, go look up the YouTube or podcast CBSE dissection. Follow that podcast word for word. You will crush that CBSE. Okay, that's the best resource. That's the best outline that I can give you. CBSE dissection on YouTube and podcast. That's going to get you to do it. Okay, let's keep moving. Guys. Let's go. Anthony joined. Davey just got the #1 gifter badge. Davey said for dental school, I got to put down deposit soon. Do it, man. Put it down. Get that deposit down. User 6255 said, do you foresee regulations changing for OMFS scope practice in terms of outpatient anesthesia? It might, but the fact is like I did my anesthesia rotation 6 or more months on anesthesia. I'm going to graduate residency in 4 months. I'm going to get my anesthesia certificate. And, I did the training. I did the work. Why can't I get the training just like the previous oral surgeons, right? So I don't know. We will see. There's a lot of politics involved with that. I hope it will continue to have sedation. If not, I don't know how much longer. I mean, if they're going to keep taking away stuff that oral surgeons have done since the beginning of time, why should we do it if they're going to keep taking stuff away from us? I mean, all these other specialties are taking surgeries that we do, and it's getting very dangerous for them to do them. I don't know. I hope you laugh says suggestions on how to stay awake late at night to study. Yes, or in class when you're starting to doze off a little bit. To stay awake, one of my tricks was I would hold my breath. I would exhale, hold my breath, and then as soon as I need to breathe again, I would inhale. That was one of the things. So get your heart. Now, I don't know if I would recommend doing this. I'm just saying this is my personal opinion. This is what I would do, and it would get your heart rate up and help you stay awake. And if you start dozing off again, like I would many times within 5 minutes, I would repeat that again. I would hold my breath and do that. That's how I would stay awake late at night to study and get awake, like wake yourself back up in class. Luke said, you're ENT? No, I'm not ENT. I'm OMFS, oral maxillofacial surgery. We do rotate on facial trauma call every 3rd day with ENT and plastic surgery. Davey said for dental school, I got to put down a deposit soon. Policy reminder, your live appears to feature discussions or topic unrelated to the product you're promote. Avoid this as viewers are less likely to engage with such content. I mean, I'm not on here to sell. Look, I just put down some things. This is the Streamlight. I use this. It's super bright. I'm not trying to sell this though. I'm just saying this is something I literally use day to day. It's a Streamlight. It's got a little port to charge. I use it all day, every day in residency. The best is in the middle of the night when you're running through the hospital seeing consults. This really helps out. Plus, it just fits in your little pocket right there. It charges. It's brighter than the battery lights, and it's rechargeable. It's much easier than going and find batteries and stuff. Anyway, I'm not selling that. I'm just giving you an idea of what I use every single day on a daily basis in the hospital during residency. All right, let's keep moving on. SNS03 said on applying with low GPA. Thoughts on applying with a low GPA and recommending a master's? Interesting. Thought of applying to dental school? Yeah, well, your DAT is going to be the metric that they use to compare you to all the other applicants in the pool that year, right? Your DAT is going to be comparative to students from other schools. Your GPA is really comparative to students from your school, right? So it's going your GPA is going to really pair well with what school you come from. Like, is it a big name? Is it not? And then your DAT is how they're going to compare to other applicants. All right, that's just thoughts on applying. Do it. Thomas Mandato commented, GOAT. Thanks, Thomas. After Thomas is Sophia, are you Dr. Owen Hunt with a Jersey accent? I mean, I have a Long Island accent, but it's pretty close to Jersey, right? It's a little bit cleaner than dirty Jersey. No, I mean, they're pretty both dirty, aren't they? Davis said, trying to decide between Tufts and KCU. You should look into, read up on the stats, look at the class size, go to the pre-net mentor map and look at the stats there, okay? On the pre-net mentor map, you're going to get a good idea of what the tuition is, what the class sizes are. You could even connect with current dental students at each of those schools and ask them what they think of it now that they're in school. That might be an idea for you. That's at the Prenet Mentor Map, okay? PrenetMentorMap.org. Chang said, would you recommend NYU Dental School for OMFS? Well, the thing is about all NYU dental schools that they have very large class sizes, okay? So they're getting in, they're not getting in more than maybe 5 to 10 students into oral surgery. If you look at some smaller programs in the area, you got Columbia, they match a lot into oral surgery, Stony Brook, UConn, Harvard. Those are nearby schools. UPenn, nearby schools to NYU that do match a lot into oral surgery, comparatively, like percentage wise. And for OMFS, now you can't pick a dental school necessarily based on this, but you can evaluate a dental school based on their likelihood of placing you or you matching into a specialty from there. Okay, so that's the best recommendation I could get. And NYU, they have a big class size, so the percentage is a little bit smaller. Make sense? User 6255 said, how do you think that would change the outlook of the profession? It would change the outlook of the profession significantly, because what I would argue is periodontics, right? They have a 3-year residency and they take no call. And a lot of these peri residencies are going heavy on the implants. They're doing light sedation now too. They're stealing the Versed at the midazolam at the dental school. What's the difference at that point between a 4-year oral surgery resident that can't do anesthesia and a periodontist that can do light sedation? So now we're like seeing serious issues in that overlap. That's really not good, right? Oral surgery is going to be doing all the bigger things. They take call through the residency. It's a much more rigorous and very challenging residency. Perio is much different in the residency program, right? You're not taking call. You got a nice little 8 to 5. Maybe stay later here and there. Oral surgery is easily putting in more than double the amount of hours in a week than a periodontist resident, right? These are the facts. I'm telling you for certain, okay? And people can argue this all they want. I'm telling you, you're not taking call in a periodontist residency, okay? And it's only 3 years. Oral surgery is 4. So if they take away an oral surgeon's anesthesia license, there's going to be some serious changes in the future. So yeah, that would have a very, very negative outlook on the profession of the 4-year oral surgery residency spot, okay? And you can't, the 4 and 6-year oral surgery residents, they generally get the same residency, the extra 2 years and the 6 years in medical school. Otherwise, everything else is the same. There's no surgery a 6-year MD oral surgery resident can do that a 4-year can't, right? It doesn't, that's not what it has to do with. So I would just consider that. Your fave Indian said, I hate Orgo 2. Orgo 2 was so much of the reactions, dude. Orgo 2 was awesome. What are you talking about? Dash said, I will graduate in June having a BDS. How do I proceed to become an OMF surgeon? And thank you. Yeah, so BDS. So you're from outside the United States. To do dentistry or oral surgery in the United States, you'd have to repeat 2 years in like one of those international combined dental schools, like NYU, like I think Rutgers has it as well. I think Toro, Columbia have that. You have to repeat at least 2 years of dental school, and then you could apply to residencies from there if you get like your application in order. User 6255419, you got ENT doing orthognathic is crazy, but they're doing it. They don't understand enough about occlusion. I agree. I mean, ENT can do orthognathics, I know, but we generally base the foundation of our orthognathic surgery on, the aesthetics, the profile, but essentially the occlusion. The occlusion's got to come together. So it's interesting. I don't know. I haven't done orthognathics with ENTs. I don't know. It's interesting to consider. User 7834, was dental school difficult? Yeah, compared to undergrad, dental school was definitely quite difficult. I would say it was difficult. Yeah, it's a lot of work. Hamad said, if you had to pick another specialty, what would you pick? I wouldn't. Maybe GP, maybe perio. I don't know. I would probably not do dentistry or medicine before I would pick another specialty. Maybe. I don't know yet. I didn't graduate. Soon though. Hamad said, Davi said, is 200 class size too big? It's not necessarily too big, but 200 is a very big class. They're probably dividing it up in different sections. That's really big. User 7834, what was your class size for oral surgery? For oral surgery or in oral surgery? Well, for oral surgery, so applying 4 in my dental school of 44. So that's a 10th and 11th of the class matched into oral surgery. That's pretty good. That's pretty decent. That's 10% of the class matching into oral surgery. That's really good. As far as for oral surgery, in my residency, we have 3 per year. In my oral surgery residency, we have 3 per year. 2 of them are the 6-year track. They get their MD. And then 1 per year, which is the track I'm in, is 4 years, no MD. Much better for mine. That's why I applied and ranked it first. User 783, what was your class size for? Davey said, I'm just trying to do general. Yeah, Davey, you could do general. Yeah, depending on what state you're in, you may or may not have to do residency to do general. Shang said, thank you so much. Yeah, dude, you got it. SNS. He said, which is better for specializing, a pass-fail school or a regular grading system? Now, I am seeing a loose correlation between schools that are pass-fail and not ranked and having a better percentage in general for students that end up ranking, that end up specializing. And so maybe, but Is it actually better? I don't know. I don't know if it's necessarily better. I'm just saying a correlation that many of these schools have better percentage of matching into surgical specialties. Nope said, I want to go into dentistry, but I have a fear of throwing up. Well, generally the more exposure you get to anything, whether it's dentistry, another profession that might make you a little bit nauseous, more exposure will get you more desensitized to that feeling of wanting to throw up. Not saying that it'll go away, but it might help you bear with that, and cope with that fear of throwing up. Clay Douglas said, how does one afford to do extra activities when in dental school? Like, are there part-time jobs? There were starting to be part-time jobs. It was so interesting. I didn't agree with this, but the dental school I went to, I started to see that, like, when people left or would like move careers or change in the dental school, like they would like staff that worked at the dental school and they would leave. It was messed up. But instead of rehiring someone at this dental school that just left, they would find a way to get a dental student to, like, in a part-time job, do their role, which I thought that's not right. Like, that's someone's job, dude. Like, that was someone's career. I don't know, man. So Clay Douglas followed the. Oh, thanks, Clay. Kyle80123 said, any tips if you go to med school that doesn't teach well? Ooh, that's tough. Maybe I would consider looking for tutoring if in your med school or dental school, or YouTube videos. YouTube videos are good. You get Khan Academy. There's a lot of options to go with that, but that's a tough one, Kyle. I'm sorry to hear about that. Kyle 8 said, at Davi, I go to a school that's about 60. I wish it was interesting. I would also study with other students, see what tricks they got up their sleeve, Davey said, where did you go to dental school? I went to Stony Brook. It's out on Long Island, about 2 hours, hour and a half to 2 hours out on Long Island. It's a smaller dental school. My class size was 44. That was 3 or 4 years ago. I think it's like 48-ish now. I could be wrong. Lily said, how did your study habits change for dental school compared to undergrad? Biggest thing, I know writing is generally good, but I would write out all my studying materials and stuff in undergrad. In dental school, I tried to stop writing. I worked on getting Quizlet in to get those repetitions in, and that's what I figured out. When I started to use Quizlet, my scores went up and my studying time went down. I call that effective and efficient studying. Effective studying, getting higher scores, and then efficient studying is maintaining those high scores, those A's, but needing to study less and less time. That's how you crush dental school. Okay, that's key. M Fountain 75 said, where is your residency? It's in Manhattan, New York. Kyle just got the number 2 gift your badge. Nice. Kyle 80. Guys, by the way, this is TikTok Live number 49. The top 5 listeners, I'm going to be giving you guys a shout out in the caption of the podcast and YouTube when I post it, okay? Study with other students, LOL, the whole class failed. Ooh, Kyle, well, at least, you're not in a lone boat, You're all in the same boat together. Kyle 80123. I'm deciding between Tufts 200 or KCU 80, which is a new school. Oh, because there are 2 Kansas schools in Kansas, right? KCU, the newer one, I see. Oh, you'd be the 3rd class? Tufts generally places more into specialties, if I remember correctly, than KCU. At least because KCU is a new school, Davey said, thoughts on going to Tufts or new school where I would be the 3rd in the class? Yeah. Kyle 80123 said, at Davey, go to Tufts. One of my close friends is from Tufts, and he praises and misses it a lot. Yeah, Davey, Kyle, that's good. That's good advice. Davey, I think I would lean more towards Tufts. Yeah. Hanny DeAndre said, tips for studying for boards. Yeah, you got to. One of the things that people have the most challenging these days are eliminating distractions. You got, myself included. I try and put the phone away. I can't turn it off nowadays. Like I'm a call. I can't turn the phone off because I could be getting a call about a consult, emergency, or whatever. But what I do is I try and put it on a different desk. I got my dresser behind me, and I have chargers over here. So sticking my phone on the charger over here, but going to my desk on the other side of the room over there kind of separates it. Put the headphones on, noise canceling, really kind of eliminate those distractions. The phone's the number one distractor. You got to get a good environment to eliminate those distractions. Okay. I hope you laughed at tips studying for the DAT other than boot camp. You have Destroyer, you had DAT Crusher, you've cracked the DAT. That was good for the PAT, especially. Chad's videos were good for Gen Chem and organic chemistry. Those would be my recommendations right there. Yeah. Davey said, I'm still waiting on Midwestern Illinois, though. Well, look at those. Guys, go on the pre-dent mentor map. That'll give you a good idea of, each of the schools and stuff, what their DAT, what's the class size, what's the tuition. We're trying to add on the specializing count, too. I need some help doing that. Sean and I were having trouble getting in contact with students to change those numbers. I'll work with Sarah. Maybe we could get it on events. some events with current dental students to do that. ME6 question, I need emergency wisdom tooth removal, but I'm away at college and they don't take my insurance. I would Google the nearest oral surgeon near you, and I would look to see if they call their offices and see if they take your insurance. Make sure their Google reviews are good. That's a very important thing. Make sure they have good Google reviews. That's most likely going to give you a prediction of what they're going to be like when you get there. Okay. Couple more, guys. Couple more. It's top 5 listeners. I'm going to be giving you guys a shout out in the caption on the podcast and YouTube channel. Guys, by the way, I figured I'd bring this on. This is Streamlight. I did include it in my showcase. You can check this out if you need it. I use this every day. I'm not selling this by any means. I'm just giving you guys some insight what I use. This is a light, and it's charged by USB. Just a little something in case you're looking for something on your externship or you're about to start residency. I would look into that, okay? Don't buy it if it's over. This is not over $100, all right? It's a Streamlight flashlight. It's pretty good. Leland said, how is UPenn for specializing in OMFS? UPenn does a very good job at placing students into oral surgery. They definitely do. They definitely do, Leland. One of my co-residents is from UPenn. A couple years ago, 2 out of the 3 graduates were also from UPenn, if I remember correctly. Serena Bobbin said, hi, can you go in depth about when you can use a straw and start flushing wisdom tooth holes? Yeah, I would wait a couple days for that. You don't want to knock out that blood clot that's in the site. Now, you can gently swish, like say they give you Paradex or chlorhexidine, to rinse after wisdom tooth removal. I would just wait 24 hours before you start doing that, right? For the injection into the site, when they give you the syringe, sometimes we give people that little syringe with the spout on it. You put the spout into the site to wash it out. I would wait a couple days, at least 48 hours, at least 2 to 3 days before you start doing that. Because once you knock that blood clot out, that's when you could potentially get a dry socket. You do not want a dry socket. You don't want to be drinking through straws. You don't want to be exercise, heavy lifting, no marathons the days after you have a wisdom tooth, no spitting. When you get home and you're bleeding, don't spit that out. You're going to just dislodge the blood clot and you're going to get a dry socket in 3 days. How do you know if you have a dry socket? Well, generally, days 3 to 5-ish, you're going to have the worst pain in the world, okay? Swelling increases for 2 to 3 days, and then it starts to subside. But if you're having the worst pain in the world, like giving birth level pain, so I've heard, around days 3 to 5, you might have a dry socket, and I would try and get a follow-up visit at your dentist's office, your oral surgeon's office about that, okay? So that's my recommendation there. A couple more minutes, guys. Kyle80123 said, the OMFS in our class are super cool, very humble to interact with. Is that a common trait? You know, it is. Some oral surgeons, they're like very confident. Well, you need to be confident as an oral surgeon, so I take that back. But a lot of them might have a bit of an ego. They might be very hard ass, you know. But generally, oral surgeons are pretty chill, very humble, easy to talk to. All right, don't be afraid to talk to one of the oral surgeons. You know, they're generally pretty good. Serena Bobbin said everyone says different things. Also, if you can go in depth about coronectomy, yeah. So Serena, the coronectomy is when generally oral surgeons would defer to this treatment. It's when the roots of the tooth are too close to the inferior alveolar nerve. That's the nerve that runs inside your lower jaw, your mandible, and supplies sensation, for example, to your lower lip, cheek, and teeth on that side. If you go really far back before it goes in the jaw, it branches off and forms a lingual nerve to your tongue for sensation there, okay, and taste potentially. All right. When your roots of your tooth are too close to that nerve, what we do is what's called a coronectomy. Corona meaning crown, ectomy meaning removal. We remove the crown of that tooth and just leave the roots. It shows very little side effects by doing that. They'll either work their way out over time or, they can very small percentage, like less than 3% chance it could cause an infection. Very, very unlikely. And we just monitor those roots over time, okay? Yeah, so that's generally the surgery we defer to when roots are super close to that nerve, all right? Lily said, do you trust Google reviews for dental offices? Yeah, some of these dental offices can have it, but I would look at the whole picture. What does their social media page look like, right? Who is the doc? Do they even have an Instagram? If they don't, that's kind of sketchy for me. If you don't have an Instagram page in 2025, you don't have a TikTok in 2025, I might look somewhere else because this way you can meet someone prior to going to their office. You know what that surgeon, that doctor, that dentist, that lawyer is going to be like before you walk into their office, right? And you get an idea of, can you talk with this person? Do they know what they're talking about? Can you converse with them and really connect? Or are they just going to talk things way over your head, right? You're going to get an idea of what they're like before you walk into their office. I think that's excellent. Okay. All right, friends, just a couple more. Serena Bobbin said, they just said to use salt water and tilt my head left or right for 1 week, but I can't stand I would follow their directions. I don't know exactly what they did. I don't know exactly what recommendations they gave you. So I would stick to them. I can't do a consult or give you personal recs through social media, right? Serena Bobbin said, "Thank you so much. I feel so much better now." Oh, yeah. You're gonna be good. You're gonna be good. All right, friends. That's it. That's TikTok Live number 49. Happy Monday. Happy Monday. Wishing you guys a great rest of the week. Hope you enjoyed the live. I'm gonna be posting this later on. The top 5 listeners, I'm giving you guys a shout out in the caption of podcast and YouTube when I get to posting this. All right. Have a great night. Have a great week. Love you guys. All right. I'm signing off.